Thank you for agreeing to do this interview. Thank you, Dr. Abdallah.
A pleasure.
Please describe your education and your field of practice.
My name is Abdallah Mohamed. Currently, I'm the pharmacy manager at Orange Park Pharmacy. It's a small independent pharmacy. I graduated college in Sudan. I went to University of Khartoum College of Pharmacy. I practiced pharmacy there for a while, and I did both retail and hospital pharmacy. And I moved to the U.S. In 2003, and I got my license in Florida, and I've been practicing pharmacy in Florida probably, I would say, since 2006.
Give us a feel of a typical day as a pharmacist in Sudan.
There is not much going on there. Basically, the most important function of the pharmacist is to dispense medications. There is a lot of differences in practice between the U.S. and Sudan. The main basic difference is the computer system. As compared to the U.S., Sudan, the pharmacists in Sudan, they do not have a computerized system. There is no patient record. There is no any kind of information that's kept in the pharmacy. So it's kind of like a grocery store. You come in with your prescription. The only difference is that the pharmacist would hand you the drugs from, or the medication from the shelf. But otherwise, it's just like you're getting into a grocery store. And there is no, like I said, there is no records, and there is no counseling, and many people would walk into the pharmacy and ask for a specific medication, and they will be given what they ask for. And there is laws, but they're not enforced. So there is a lot of medications are given as over the counter, including antibiotics or antihypertensives. One of the reasons is probably people, they don't want to, pay the physician offices. They don't want to, pay for the visits, and they want to come directly. Especially if somebody is on a regular medication for a long time, they don't want to go back and do checks up, in the doctor office. It would be cheaper for them to just come to the pharmacy and and get what they've been taking. So basically, these are the differences between practice, especially retail pharmacy, between the U.S. and Sudan.
Moving on with our question, how much patient interaction do you have?
Not very much. If we're talking about patient interaction back in Sudan, and this also, it leads me to the differences between curricula between the two countries. Back in Sudan, there is too much emphasis on the product itself or on the drug. There is emphasis on chemistry and how to analyze the drug. Emphasis on the methods of detection. So basically, the basic science, and there is not much emphasis on the clinical aspect of the medications. As you know, the approach here is patient-centered, practice, while in Sudan, it is, product-oriented or product-centered practice.
Are there any programs that target the poor population, or in terms of how is the cost of healthcare covered in Sudan?
There is really not much that's set by the government or by the by the official institutions, if you will. But there is philanthropic groups and philanthropic institutions. They are willing to, you know, to help poor people with the cost of medication or cost of diagnostic procedures.
In light of that, what would you consider is the issue that pharmacists face the most in Sudan right now, or when you're practicing in Sudan?
I would say the pharmacists really need to be trained on how to be clinically involved, whether it is a hospital setting or a retail setting. At least they need to be trained on how to assess the patient, on how to counsel patients, and like just at least the main counseling points on each medication. And I think that's if that was introduced in the curriculum, it will probably move the practice a good deal.
Thank you for that insightful answer. How is prescription drug abuse handled in your country?
Well, let me first start with the fact that prescription drug abuse in Sudan is very minimal compared to the problem here in the U.S. I remember when I was working in the hospital setting, post-operative patients, they used to get maybe a shot or two of morphine and an injectable diclofenac. That's all they can get, and there was really I have never seen or heard of hydrocodone or oxycodone until I came to the U.S. So that's probably why we don't have much of that problem there. But that doesn't mean it is. I mean, there's no problem. But they might be abused for benzodiazepines or these sort of medications. But it is, like I said, it is very, very minimal.
In terms of healthcare cost, how is healthcare cost in Sudan, and for the amount of money spent, do you think it's efficient, and how you can improve?
I would say the healthcare expenses are. Let me go back to the times when the healthcare system was free in Sudan. People would go to the hospital, and they'll get taken care of in terms of their medical needs or their prescription needs, and they don't pay anything out of the pocket. But as time went by, things have changed, and now the patients, they have to pay more and more out of their pocket. But if you compare the cost of the service is probably very minimal to what is in the United States. There's no comparison. But because people incomes are very, very minimal, it is still a problem for them, to pay for healthcare services. Like I said, people depend on their relatives or on these philanthropic institutions, to take care of that.
As a healthcare provider, you've seen the different level of medications that are offered in the U.S. by the big pharma companies. In terms of medication in Sudan, what is the most consistent or the big source of medication in terms of pharmaceutical companies?
Well, there is local pharmaceutical plants in Sudan, but of course they don't offer everything. They produce these very basic, antibiotics or antihypertensives or antidiabetics, but most of the medications they either come from regional pharmaceutical companies like in Jordan or Syria, or and also some European countries. And I remember maybe Boehringer Ingelheim, they have some like local agents in Sudan. So as European countries, I think Germany has the highest share, I think.
Lastly, Dr. Abdallah, I would like to ask you, is there a message or advice that you'd like to give to pharmacy students in Florida?
Yeah, it's probably pharmacy students everywhere in the U.S. The pharmacy profession, I mean, all of us, we have to do something to advance it. And I think the way things are done here in the U.S. is to get involved, in the political process. Things are done by lobbying, and I would ask pharmacy students and future pharmacists to get involved and to get to know the political process in the U.S. Because now we have an issue still pending, which is the provider status for pharmacists, and people really have to come together and work on that issue, so we can advance our profession.
Thank you for that insightful answer. I'm sure everybody have something to take from our interview session. Thanks once again for agreeing to do this. It means a lot.
My pleasure. My pleasure. Thank you.
Thank you.
Okay.